as introduced by Dr. Unraveling. Thank you for the introduction. My name is Richard, and I've been working with the Science Lab for the past 2 months. And today I will bring you all on a journey to navigating the digital age of cerebral aneurysm with a technique called computer fluid dynamics. First, I will talk about the methodology of the technology, and followed by some outcomes analyzed from data, and finally, some of my personal future insights. So what is CFD? This may be your greatest question right now in the room. Traditionally, medical workers would use endovascular techniques such as DSA to retrieve information, like especially structural information of the blood vessels within a patient. And then based on these data, surgeons and doctors would make decisions on whether to intervene or not. And in a surgical setting, either minimally invasive stent or coil is applied, or as this picture shows, an aneurysm clipping procedure will be performed. And in 2009, it was a great year for CFD because it was when the first paper of CFD came out, describing the possible usage of CFD, this novel technology, on modeling the hemodynamics of the human blood vessel. CFD actually originated from a physics concept where engineers, especially like hydrophysics engineers, use it to model how rivers flow and especially how the hemodynamics are performed in a physical environment. So in brief, CFD bridges the gap between imaging and intervention in the neurosurgery field. So just like any other computational models, the greatest challenge here is to establish and determine the necessary patient-specific parameters. And in our project, our primary focus is on a parameter called blood viscosity. Here's a bit of physics class. So blood has been proven to be a truly non-Newtonian fluid, meaning that its ratio of shear rate to viscosity is not constant through different situations. As shown in the bottom left graph, the shear rate of the blood increases with lower viscosity, which induces faster flow rate, which is pretty straightforward. Therefore, measuring the viscosity makes it possible to be a predictive method to obtain the wall shear stress, which contributes to aneurysm growth. This is especially significant in smaller vessels, where a change in blood pressure may easily trigger a larger impact on the vessel walls because more force is exerted. However, in a larger vessel, the Newtonian model, though is more uncertainties, we can actually use it. It is possible for using a Newtonian model to model the hemodynamics to reduce variable complexity. And currently, blood viscosity is measured indirectly through its relationship with red blood cell concentration inside the blood. And the crucial part here is patient-specific parameters, since the different patients have different like demographics, various comorbidities, and different social histories, backgrounds. They all have individual factors that impact their blood viscosity and blood flow. This is also the aim of our project, which is to understand the details we need for accurately capturing all the parameters behind the hemodynamics that may affect further procedures like surgery. One of the advantages of utilizing CFD is that it can generate dynamic outcomes compared to the static photos and models we get from techniques such as DSA, CTA, or MRI. Accordingly, the analytical outcomes in the data are also dynamic, based on a cardiac cycle as shown in the bottom left graph. A proper analogy of the blood vessel is thinking of it as a drain pipe. So with more wall shear stress, the more force you exert on walls, the likelihood of malformation will increase. So consequently, the maximum wall shear stress, we have observed that it tends to occur near the neck of the aneurysm, where it binds to the healthy tissues of the rest of the vessel wall. However, in contrast to that pathogenic effect of a high wall shear stress in the initiating phase of an aneurysm, we actually find lower wall shear stress can help in the growing phase of the aneurysm because of its degenerative effects on the aneurysm wall. While we haven't come up with a certain set of parameters that are reliable enough for CFD to be truly used in solving clinical problems, we can now see the potential of the technology in our project as a risk assessment tool. By understanding the hemodynamics and interpreting the outcomes, the model can identify the residual flow velocity, which is a strong indicator for aneurysm recurrence or aneurysm rupture. Further on, transferring the role of CFD from a preoperative tool to an intraoperative assistant will further help surgeons to assure success in their procedures by providing possible real-time data. So how can we get from where we are to where we want to be? If I'm asked to describe the future of CFD, it will be adaptive. To begin with, as mentioned earlier, current viscosity is only measured indirectly by the inference from red blood cell concentration, which is tested through regular blood tests. Therefore, we need a more direct way to measure blood viscosity, as we still haven't found it right now. So we need a more efficient and reproducible data retrieval method that needs to be developed for the patient-based feature. Besides, we know that viscosity cannot be the whole story determining aneurysm growth. So researchers will need to discover more unique parameters and factors like viscosity so that they can convert quantified measurements into correlations. Ultimately, I believe it will be possible to establish an automated evaluation system of the parameters based on computer technology such as machine learning and deep learning to help surgeons better understand the outcomes. And last but not least, it is important to keep in mind that CFD as a technology tool needs to be adaptive to its users. From surgeons to professionals to even daily patients, we expect the interpretation of the outcomes to be accessible for all groups of people. Patient-to-patient variation in viscosity wasn't determined as a very important factor before, but now we've known how the world of physics, hemodynamics, and neurology can collide. With the increasing popularity and efficiency of utilizing computer technology across the fields, it's now more important for not only medical professionals, but everyone to learn with interdisciplinary. For the past 2 months, I've shadowed doctors with different backgrounds, including radiology, oncology, and even naval sciences. In the past, their experiences may only be applied to their according fields, but nowadays it's possible for them to integrate their knowledge into the neurosurgery field due to the alleviation of borders between the subjects, while the algorithm-based computer services cover what used to be the unique edges. For instance, operating skills or steady hands that can only be gained through time and personal development in the past. I've also encountered the amazing ROSA One brain system that provided incomparable precision of mapping the brain and assisting the retrieval of tissues for biopsy, making it possible for surgeons to spare their attention from operating and maneuvering complex surgical equipments to offering better care with their knowledge and problem-solving skills. Similarly, CFD will save researchers' effort to struggle with data accountability and the surgeons' effort for information accessibility. It's been a great time and great pleasure for me to work with these amazing faculties and professionals in the field for the past 2 months. Witnessing the advancement in technology, medicine, and public health accessibility allows me to see neuroscience from the perspective of researchers, engineers, and surgeons, and more importantly, patients. I've also learned to see problems from different angles and ask better questions. My unforgettable experience here wouldn't be possible without the support from the program faculties and UW Department of Neurological Surgery staff. I'd like to appreciate Dr. Ellen Bogan for having the insight to inspire, to build this program and keep inspiring young people like me. And I want to thank the Science Lab for having me most of the time of the program. Dr. Levitt and Dr. Fillingham showed me how to behave professionally and think professionally, with all lab members offering a friendly working environment and helpful advice for my career development. Finally, I'm grateful for spending the summer with all the other NSSP 2023 students, as they represented a variety of cultural backgrounds, and they are all passionate individuals whom I believe will surely succeed in the future.